Okay,
so good. So ladies are there already.
Technical difficulties as always, but it's fine. We're still here. We've showed up, and we're going to try and help as many people as we possibly can.
Good. Okay, ladies. Thank you. So for those who don't know, my name is Ilva Urbanovica. I am Weight Loss Latvia. I can say that. So I am the one who organizes all the trips for bariatric surgery here in Latvia and for Sigulda Hospital to see Dr. Oleg Kozlovskis and Dr. Yuri Zharinovs and all the team. And I'm really happy to see Ivan Patel again on our online conversation, as we are talking all the time how to live, how to prepare for the surgery and how to live after the surgery. Then the question about the proper supplementation after the bariatric surgery is really important. So that's why we are here today. And of course, you are getting the recommendation list from Dr. Olex also and the Sigulda Hospital here. But one is in the UK, and many of our patients are coming from the UK and also the Ireland. So the regulations there and recommendations there might be maybe a bit different, but in general it's similar. So, and one is a certified dietitian, is working with bariatric patients specifically for, I would say, 30 years already or more. It's already.
It is. It's 32 now. Oh my gosh.
And so one knows exactly how and why and when, and also like seeing so many patients' stories in long term already. So you have also more likely definitely your gut sensation about that, what is working and what is not working, and how it should be done properly. So yeah, so maybe then we can start with that you are telling the most these important cornerstones for the supplementation after the surgery, when to start, what is really important, how long to continue, and all these questions together.
Gosh, I'm going to try and remember all of that. So thank you all for inviting me. I know we had a discussion. I said, hey, look, why don't it's easier maybe that we just have a conversation, because it can be confusing, because abroad it can be slightly different, and in the UK we have specific guidance, and many of your patients will probably go and see their GP and they will reject them to prescribe all their supplements or do their blood tests, because GPs really don't know what to do. And this is why we're connected to do today's session, but also you have all this information beyond Bariatrics membership, which we'll talk about later. But supplementation is so important, and I think many people might start off with good intentions to take it, and after a while it can become a bit of a headache to take, or they run out of supplements and they feel okay, they're losing weight, so they think everything is okay, I don't need to take them. But that's wrong. You'll have to excuse me because I've had a terrible cough, so I'm going to have a drink because I'm going to keep losing my voice.
It's okay.
But anyway, I normally recommend when people start their pre-op diet that they start taking a multivitamin and mineral. Now, in the UK, the most standard multivitamin and mineral that is the gold standard is Forcival, and you take one a day. But the thing is, it's quite an expensive supplement. So generally, I would recommend that you have a over-the-counter supplement that's a complete A to Z vitamin and mineral. And it's got to have things like zinc in, copper, selenium, thiamine, and iron. They're the basic minimum, as well as all the vitamins and other minerals that it has. So some that I recommend are things like Synatogen A to Z, Centrum, Boots A to Z, Superdrug A to Z, Tesco A to Z. They are complete. I've checked them. They are fine, but you need to take 2 a day. So when you're pre-op, you could start by taking that. Then when you're post-op, I would probably say for the first 2 weeks, and I know Dr. Olegs and Ilva say the same, don't worry about your supplements and vitamins, because it's important to have your protein shakes and your liquids, getting those in. And also your protein shakes will cover most of your vitamins and minerals. But after, when you start the puree diet, that's a good time to start your vitamins and minerals again. Now, in the UK, we normally recommend until you start solids that you have chewable multivitamins and minerals. But if you're okay and your supplements are small in size, then you can take the tablets. But the guidance from the UK is that everything should be chewable, liquid, or crushable because your stomach is healing. The other thing that can happen after you've had surgery and you're taking supplements is that you can feel quite nauseous because the supplements are quite strong. So you must have them, especially in the early stages after food, to help minimize that nausea. So it's really important. So the first thing is you take your A to Z multivitamin and mineral, and it is for life. A lot of people are told 3 months and so forth, and that might be the advice that's recommended abroad. But in the UK, this is what we recommend, and I have to advise what our UK guidance is. So I'm not sure how that, I think, is yours. I think with some of your supplements, it may be a little bit less, but that's the basic, taking an A to Z multivitamin and mineral. Then in the UK, you are advised to take a calcium and vitamin D supplement. So things that I would recommend are things like calcium Adcal or calcium citrate. Now, the calcium in there will be about 1,000 to 1,200 milligrams a day, and you'll have about 800 IUs of vitamin D. And you would take 1 tablet twice a day. And the lucky thing is most of them are chewable. And you can take that with your vitamin and mineral in the morning and your vitamin and mineral in the evening because they will work well. And again, that is for life. However, when you first have surgery, so let's say if you have a gastric sleeve, you need to have your blood test in the first year twice. Once at 6 months, then 12 months, then you have it annually. If you have a bypass, we recommend that you have your blood test every 3 months in the first year and then annually thereafter. Excuse me. Thereafter. So let me have a drink of water.
That's okay. Well, maybe we can no. So as we are offering this 3-month subscription with you after the surgery, so the people are getting also this all information from you afterwards.
It's all on the, yes, the information is all on the video platform. So calcium and vitamin D supplement for life, because we need to keep your bones healthy. The other thing that we recommend is for most women and men is to take iron. And I know you say the same. Now, for women that are menstruating, or if you have a low iron before surgery, we recommend you take 2 iron supplements a day. For women that aren't menstruating, or for men, we recommend 1 iron supplement. And again, we recommend that you take it for life, but you have adjustments according to your blood results. So if your iron levels are very low, you would need to take more iron. If your iron levels are very high, we would recommend that you reduce your levels of iron supplementation. And this is why aftercare is important with your blood tests and getting the advice. The other routine supplement that you will need to take is vitamin B12. And in the UK, we recommend the gold standard is to have an injection, 1 milligram injection every 3 months. Again, with your blood testing, we might adjust the dose, but I know it can be difficult to get the prescription for the injections from your GPs. So the alternative that I recommend is a daily spray. Now, I take it myself just to see if my B12 levels have gone up, and they are shot up. Each time I go to the doctors and they go, your B12 is really high. So I know the B12 injections that spray works. So that's an alternative, and it's very affordable. I think they're about $6.99 or $7.99 for a bottle, and it lasts, I'm thinking it lasts a good 2 to 3 months. So that would be an affordable option. They are pretty much the basic supplements that you would need to take for your weight loss surgery continually. And I think what happens is, like I said, is everyone feels so well after they've had the surgery that they think, I don't need to take those supplements, but you do, to prevent the deficiencies.
So basically, I'm trying to make a conclusion. This is like vitamin supplement A to Z, then iron separately and calcium separately, B12 separately.
Yes.
Vitamin D.
Calcium and vitamin D are usually combined as one.
Yeah.
And you take the iron and calcium separately, 2 hours apart, because calcium stops the absorption of iron. So, and I'm sure they get that advice, and the advice is the same in the UK.
Yeah, it is. It is. Kara is asking, should she be taking B12 spray now, 3 weeks post-surgery? Yes,
she can take it. Yeah, she can take it. Yeah.
And she was also writing that she's really struggling to swallow supplements of 3 weeks post-surgery. Then this is the option about this chewable or to.
So, usually what I recommend is that you can try Centrum Chewable for the first 6 weeks. It's not complete because it doesn't contain copper. So after 6 weeks, you would need to go on to your tablet form, which isn't chewable. The other mistake that I see a lot of people making is they take these gummy vitamins and minerals. They're not complete. They're not enough. So it's better than taking nothing, but they are not a complete. It has to be a complete A to Z multivitamin mineral. And you have to take 2 of those supplements a day to make it complete for you after surgery. And that's really important because the most common vitamin deficiencies that I see are B12 deficiency, selenium deficiency, and vitamin D, actually, sometimes thiamine. And I know we've had, and they manifest in very different ways. So let's say everyone experiences hair loss, right? Hair loss, unfortunately, is part of the process of surgery, from the trauma of surgery, from the fact that you're not eating very much, from the point of having surgery to having surgery, your nutritional intake goes down, but also you're not absorbing all your nutrients. So when you start to experience hair loss, it's for those reasons. But other reasons why you might continue to experience hair loss post-surgery, so if it carries on for a long time, could be due to low iron, low folate, low selenium, low zinc. And along with that, you will find that you feel really tired and exhausted when your iron and your folate and your B12 is low. You might find that you're breathless if your B12 is very low, as your iron is very low as well. Whereas when your B12 is low, you might experience symptoms of brain fog, you're really confused, you might have blurred vision, or you might see lots of stars in front of your eyes. You might find that your tongue is very sore, you might have cracks on the corner of your mouth. You also might find that you become very forgetful. It's a bit like perimenopausal, but that's what B12 deficiency is. So that's why it's really important. Now, when you have your B12 levels checked, the standard way of checking your B12 in the UK from a GP is that they check your blood levels, but sometimes they don't actually, it doesn't measure how much active B12 there is. So you might find that your B12 is within the normal range and your GP will say, oh, you're okay, you don't need supplementation. But the thing is, we like bariatric patients to have B12s in the 700, 800, 900s, even sometimes in the thousands, because then we know the amount of active B12 should be sufficient. And that is to prevent B12 deficiency. Another vitamin deficiency that I'm seeing, I used to see lots of in the NHS, but not so much, I think, privately, because I think a lot of GPs don't check selenium, is selenium deficiency. Now, selenium deficiency can make you feel really tired, exhausted. It can affect your thyroid function, but it can get very confused in all the other deficiencies unless if it's checked. So if you take 2 or 3 Brazil nuts a day, that can cover your selenium intake if you're not absorbing enough from your supplementation as well. But that used to be a very common mineral that we saw deficient in a lot of our patients. So they're the common ones that we see. Now, with calcium and vitamin D, if you have weak bones or we're older, so when we stop menstruating, we need to make sure we're getting enough calcium in the diet. Now, if you are having lots of calcium in your diet through milk, dairy, yogurt and cheese, sometimes you can cut back on your calcium supplement. But generally, it's better to take your calcium supplement with your vitamin D for the best absorption, because then we know that you are on track. The other thing in the UK, and you might find this the same, Ilva, where you are, that patients have low vitamin D levels. And that, again, if you do have low vitamin D levels and you are taking your normal calcium and vitamin D supplement, you may need to go and see your GP to get, first, the only way you're going to know is by getting your levels checked. And if it is below 30, you might need to take a high dose of vitamin D, which can only be prescribed by your GP. So you're only going to know that if you are having your blood tests regularly and you've got support and advice for that. I'm just trying to think what else I see a lot of in the UK, but it is mainly, I would say, low iron, B12, selenium, maybe vitamin D, but I think most of us are very low in vitamin D. But sometimes we do see in patients that struggle with their weight that they have very low vitamin D levels.
It is usually they are glad that people are coming before the surgery already.
Yeah.
That's like really common for northern countries. It is that we are having. Yeah, that's the same in Latvia also. When
not enough sun.
Not enough sun,
also,
and even not enough time outdoors. I would say also.
Yeah, and also we're all wearing SPF, which stops the absorption of vitamin D as well. So it's like, what do you do? Do you protect your skin or do you absorb the vitamin D? So, and also, we all absorb vitamin D very differently. Some people can be out of the sun, use SPF, and still have good vitamin D levels through their diet. Whereas other people, it's not the same. So it's a bit of a lottery, I think, with the vitamin and mineral status and the deficiencies.
Rachel is asking, what you mentioned, the supplement that begins with F.
Forceval.
Forceval. Can you write? No.
Yeah, FOR.
Forceval.
Okay. Yeah. FORCVAL. Now, Forceval, you can, I think you can get, you generally it's prescribed by the GP, but you can get it online. I think it's through Amazon. Now, the thing with Forceval is that you only need to take one a day if you take the Forceval, but it is a very strong vitamin and mineral supplement. So a lot of people find that they feel a bit sick with it, nauseous. That's why I always say maybe take the normal A to Z that you can buy over the counter and just do a day separately, once in the morning, once in the evening. You might find that will be a lot more gentler on your stomach, whereas Forceval is very powerful. Some people can tolerate it, some people can't.
Okay, so then this quite common question is how long should you were touching a bit that question, how long after the surgery should I take my vitamins, minerals? Is it for all life now? And so people kind of feel bothered about that they would need to keep this routine for all their lives. It kind of seems complicated, but because also some pages are recommending, of course, natural food and natural things, and from the food are the best to get the vitamins. But why it should be taken all the life? With gastric sleeve, for example, if you compare to gastric bypass, with gastric bypass there is this malabsorption, but with gastric sleeve there is no malabsorption. So someone might think that there is no need to take the vitamins.
You can think about it. In both procedures, you've only got 20% of your stomach. You're only using 20% of your stomach. So really you're getting 20% of the food that you eat. You're only getting 20% of the nutrients that you absorb. And because the stomach has been altered, the absorption of nutrients might change a little bit. So the food might move through slower or quicker. And also in the first 3 months when you're taking those stomach protectors, the omeprazole or lansoprazole, to allow your stomach to heal, it changes the acidity in the gut. Now, by doing that, it might affect the absorption of iron, zinc. It will absorb the vitamin D, B12 supplementation. It will affect the absorption of certain vitamins and minerals. And that can take another 3 months to recover. And it may never recover if you don't improve your gut health. So that's why we recommend that you take your supplements for life, because you're only getting probably 20% of what you need, because you're only eating 20% of the food, because that's the capacity that you have with the sleeve. Now, with the bypass, it's a very similar situation, but also you're having your bowel replumbed. So you're missing a section of your bowel to absorb certain vitamins and minerals. So that's why, again, with a bypass or even other procedures that are like SADI and the mini gastric bypass, it's very important to make sure you take your vitamins and minerals and you take them lifelong. The only time you would be advised to stop your vitamins and minerals or certain supplements is if your levels are extremely high in your blood tests. And that's why blood tests, especially a couple of years after surgery, are really, really important, Ilva, to make sure you go and have them. A lot of people forget after a couple of years because they feel so well or they feel normal, they feel they don't need to. But sometimes the blood tests tell a different story of deficiencies or high levels in the blood. So that's why it's really important. It's like an MOT. You know, your car has to be checked every year to make sure it's okay and it's functioning properly. It's the same with your body after surgery. You have to have that MOT.
But what I'm usually trying to say that this is not just because of surgery, but it should be for every person with or without the surgery, like a normal routine yearly checkup of health, and so that is not anything specific kind of to do. Just maybe many of us need to learn to take care more of our health, and especially after bariatric surgery, it is even more important.
And I think sometimes, you know, especially for women, we find it very difficult to put ourselves first because we might have children, we might have grandchildren, we might have older parents that we're looking after. And that's a common running theme I see amongst women. And sometimes, you know, women feel very selfish putting themselves first. But the thing is, putting yourself first doesn't mean that you're being selfish. It's just self-care. You are looking after yourself. And if you are in the best health, you're able to help other people. That's how I see it. But I know some women find it being very selfish, but you're not.
I agree, absolutely. Because we have to be happy, first of all, and then everyone else will be happy around us.
Absolutely. So what do they say? Happy wife, happy life.
Yeah. Agree. So, Kara is asking, have you heard of Baricol supplement? Is it similar to Forceval?
It is very similar, but with Baricol, then there's other products like Bari Ease, which is a powder supplement, and there's Fit For Me. The only thing that sometimes concerns me about some of these supplements is that the iron is inbuilt in the supplement. So the thing is, calcium and iron don't work together. So you might still need to take an additional iron supplement on top of the Baricol that you are taking. But again, you're only going to know that by having your bloods taken regularly. So yes, Baricol is a good supplement, but the only thing that I'm not sure about is the fact that the iron and calcium are both in there. So do they affect one another's absorption rates? That's all. So again, your blood test will, so for some it works, for some it doesn't. And that's the conversation that the dietitians are always having. How is it affecting? Now, for some people, it's fine and your iron levels are fine because your body compensates. But for some, it just doesn't work. So yes, if you want to have Baricol, it's fine. I think cost-wise, I think it's quite good. I think it's about £30 for every 3 months, or is it a month? I'm not sure, but you could get your over-the-counter. I know supplements a lot cheaper than that, but the price of everything is going up, isn't it? So you've got to do like the analysis.
So Rachel is asking for 4 weeks for omeprazole or similarly proton pump inhibitors. How long do you recommend? The Dr. Alex Kozlowskis recommends to take 4 to 6 weeks after the surgery and then up to needs. As and when Rachel is asking, should she continue taking them, or she has got...
So in the UK, we recommend 3 months.
3 months.
Yeah, we recommend 3 months.
Longer.
Okay. But so again, it's for you to decide if you find that you're getting some heartburn or reflux or your stomach feels a little delicate. I would continue with it, but no longer than 3 months.
Then occasionally, what is also often the question about the pain relief medications? Maybe we can add on this too. Which pain relief medications would be recommended after the surgery? And
well, I'll tell you what you shouldn't be using. non-steroidal anti-inflammatory drugs. So things like ibuprofen, aspirin.
Yeah.
You don't want to be using those after surgery because they irritate the stomach and you might have an ulcer. But things like codeine, paracetamol, they are safe. Yeah.
Mm-hmm.
And then if you are taking things like ibuprofen or aspirin or naproxen, you would need to speak to your GP to see what alternative that they could prescribe. Now, sometimes what seems to happen is you need those for pain relief because of joint pain and so forth. But as you start to lose weight, the joint pain goes away, so you don't need those medications. So, but sometimes I do say, and some of the consultants in the UK would also say this, is that if you take naproxen or ibuprofen ad hoc, take it in the liquid format. So you can get a children's ibuprofen, which is in liquid format. So if you're only taking it once in a blue moon, that is fine. But if you're taking it regularly every day or a few times a day, then we say no.
Yeah. Okay. This is what with for example, antibiotics after the surgery, when you're taking the sometimes people have different issues and they need to take this. What is your recommendation to?
So if you're prescribed antibiotics for whatever infection you have, obviously you're going to have to take them. But after you've taken them, what you're going to find is it's going to affect your gut health. And what I mean by that is antibiotics don't just kill the bad bacteria, they kill the good bacteria. So taking things like Actimel, kefir, fermented foods are really good for your gut. So you need to fuel that. So look after your gut to help with its digestion. So that's really important. The other thing is Yakult. They all have like strains of bacteria which help with digestion and keeping your gut healthy. So if you've taken a course of antibiotics, you need to remember to make sure you are feeding your gut with all the good bacteria that it needs. So that also means having lots of fiber in the diet, so the veggies that you're eating, because you can have the Actimel, you can take probiotic supplements, but they are only going to survive and grow if you give it the food to feed it.
Yeah.
And the food that feeds it is the fiber, the vegetables, the fruit. So that is really important, yes, after taking antibiotics.
Okay, I think it's pretty clear now, of course, but that maybe Chiara is asking, what about collagen for the skin during the weight loss?
Yeah, you can take collagen. In fact, try and take it every day. What you've just got to remember is it can count towards your protein intake, but also collagen isn't a complete protein. It's got an amino acid missing. So collagen is good for skin, hair, and nails. So you can take it for that component. So that's not a problem. But collagen isn't going to have everything in, all your vitamins and minerals for bariatric surgery and onwards. So yeah, collagen is fine, but it doesn't replace the protein that you eat in your diet, if that makes sense.
Yeah, that makes sense. And so I think then we can slowly, as I mentioned already, and my people know that we are offering 3 months subscription with you on your platform, Beyond Bariatrics, and where you also can get this information about the supplementation and recommendations for eating, because the mindset change takes time, and I'm really happy to offer your services. Thank you for supporting our patients and to give this simple important information. And I have to be honest, I have noticed that some people are not using properly. I would love to push everyone to use it. Yeah. And I'm always telling, because it really takes time. And even though we think that we know everything, but knowing something is one thing, and implementing these habits in our daily routines and to give it proper time to settle down there. So this is totally another thing. And yeah, maybe you can briefly tell, what do people get in these 3 months when they join to be on
definitely. I think the biggest issue that we have when it comes to weight loss, whether we have surgery or not, is we think about calories, we think about weighing off food, we think about restricting food. And there's an element of truth in that. But what's really important is how we fuel our bodies. So the membership, the 3-month membership that you have access to, is all about helping you understand how to recover after having your surgery. In fact, it starts pre-op, but you won't need it pre-op because you've already had the surgery when you come to me. So we have a video platform with resources which takes you from having the surgery. So it talks about the liquid diet, the puree diet, the soft diet, and then progressing to solids. And you get an ebook and you get a meal plan to give you as a guide with recipes. So you know exactly what you need to do at each stage. So that will help you fuel your body. Then there's a huge section about how to work with your surgery, because when you have surgery, especially the honeymoon phase, it's going to feel like it's doing all the work for you. And it's such a great feeling, but that is going to wear off after a while. So to fully understand how you work with your surgery by slowing down your eating, keeping your fluid and food separate, your plate size, how to balance your meal is really important. Then we start to focus some of our energy on the different food groups that you need to fuel your body and so forth, and how to change your emotional eating habits, your lifestyle, and your mindset to make sure that you are able to lose the weight and get to where you want to be. So a lot of that information is in the video platform. We also have our own Facebook group, okay? And in that Facebook group, every week, people can post food about what they're eating so that I can help sort of guide them about what's on their plate, the balance of food on their plate and so forth. And we also have every Friday an accountability post, which is called Friday Wins. And in that wins, you can let me know if you're losing weight, you're maintaining, you can talk about non-scale victories. And I look at everything just to see what's going on. But we also have additional things that we do in the group. So some of you may have seen, if you joined a month ago, that you'll have information about how to work with your surgery. There'll be little challenges that we do. So this week, the challenge that I have posted is that everyone's got to clear out their wardrobes of all the clothes that don't fit them, because this is a mindset thing, but it will also save you money. So when you clear the clothes out of your wardrobe, you're getting rid of the bad energy, because if you keep your bigger size clothes in your wardrobe, you're telling your brain that you're going to go back to that size, because when you've tried to lose weight in the past, you've always regained the weight. So you keep those clothes just in case. Now that you've had bariatric surgery, we don't want that just in case mindset. We want to clear that energy. So there's lots of things that we do to help support you. As long as you've got the videos, you've got the Facebook group, you've got monthly things or fortnightly things that are going on. We have a monthly group coaching call, and then every 2 weeks we have a Q&A session. So there's lots of support. And I know that some of the ladies that are asking questions, I might just download the PDF about all the vitamins and minerals that you can take after surgery just to help you. But there is a lot of support. I try and do my best trying to answer everybody's questions. And it's a group of lovely women in that group and men. So please make the most of it, because you get it for 3 months. Ilva is offering this to you. And I think it's really important to fully understand that surgery is the first step. And in fact, it might be the easiest step. The big work comes after you've had the surgery, because that is going to determine your long-term success. And that's why we have this 3-month access to the membership. And then if you want to then renew, you can do. And I know that some people have, but that's why.
Mm-hmm. This is really important, actually, also for that. Unfortunately, we are having also people with gastric sleeve surgeries coming back to get the gastric bypass. And then I'm also trying always to go through the basic reasons why you had the sleeve and where you were, without, of course, blaming, because we are having different situations and life is hitting sometimes, and maybe someone did the surgery, was not ready for the surgery that time, but now they're ready for the other step. And so we have different situations, but this is what I'm always telling, that the surgery is a tool and you have to really learn. And this question, if this is my last meal before the surgery, normal meal, or kind of these questions, and this about this normal stuff, that this normal is changing to totally different.
And the thing is, you know, because I see a lot of revisional patients that sign up with me. I know there's some that come through to you, and you're right. A lot of the ones that come through to me directly, they've not had support. They wanted the surgery to do all the work, and you know, deep down, I know that everybody wants that. I would want that if I was paid a lot of money. The reality is, the surgery does part of the work. The rest, the big job is us. We've got to do that.
Exactly. So we have so thank you. But yeah, maybe I will explain then when you join this Beyond Bariatric platform. So there is from the very beginning, the first steps after the surgery, because it's also many people are afraid even to start the first meals because, you know, there was a surgery on the stomach, and how to put something in there now, how to feel whether I'm overeating or I'm undereating, or do I need to take this? Do I need to take in half an hour, or should I sip this something through all the day? So these are things that are really confusing, and it's in the beginning it is confusing maybe to find like this, to listen to your body and to understand what my body is telling actually.
It is, because if you think about it, most women and men that have been told to lose weight have relied on counting calories or weighing their food to determine how much they should eat. They don't tune into their, oh, I feel full. They rely on what's on their plate to determine how much they can eat. They might still be hungry, but because the diet plan has said that's how much you eat, that's all you can eat. So a lot of people are still hungry when they're on a very strict diet. When you have surgery, you've got to start trusting your gut, literally. And it's funny we say that because you've already had about 80% of it removed or remodeled, but it really is about tuning in to your fullness signals, because obviously you're not going to feel hungry after the surgery, and that, which is a blessing, but some of that hunger does return, but it comes back more with a vengeance when you're not fueling your body, when you're being too restricted. So this is why I always say it's really important to fuel your body, but also make the right lifestyle changes. So something like sleep. If you improve your sleep, it will improve your weight loss, because your body has to rest to lose weight. But so many people are up late, probably only getting 4 or 5 hours of sleep, and that's normal for them. But your body can't go into fat burning mode if you're only having about 5 hours of sleep. It needs more. So there's so many things that we have to think about when it comes to weight loss. It's not just the food that you eat. It's not just about exercise. We have to look at things like stress, sleep, hormones, your habits, your mindset, emotional eating. They all come into play. And once you have surgery, we've got to tackle all of these elements to make sure you lose the weight and that you keep it off for good, because that's what Ilva and I want for you. We want you to have the surgery, to use it as a tool. And, you know, however lovely you are, we don't want to see you again in 2 years, 3 years, 5 years to say that you've put the weight back on. We don't want to see that. So this is why you've got a small element of support. And if you want more, you can continue to have the support.
Okay, I think Carrie is writing that we have reached the 40 minutes cutoff, but I still see that we are online. So, but maybe that's the time. Yeah, there are some comments about the wardrobe. It's opposite, full of small clothes. And, yeah. So. It was really lovely to talking to you, Van. So I think we will do again and again, and we will, as we always think, that we have to do it more often. And actually, no, okay, I say no, don't mind this. No, it is more than 40 minutes. Yeah, right, Carrie, you were right.
We'll switch off when it comes to almost an hour, so don't worry.
Yeah. But everything is so far so good. And I, again, thank you very much, Van, for supporting people and for this valuable information, because I think it's really, really helpful to give these guidelines and not to lose the track. And to my patients, I really recommend using one service, and also to switch to Zoom calls and to use the group and use maximally as you want. And I encourage also to write personal emails to you if there is some issue, or to contact me, then I can ask you.
They can do it all in the group, and when they come to the monthly coaching call, that's where they get their personal support. It's like having a one-to-one call with me, but without paying a big fee. So, you know, there's so much you can get in there. And also, you know, if you want to just ask a question, there's a lot of my one-to-one clients are in that group. They would have had the personal support. So they've got a lot of the answers that you're looking for. So even if it is between the monthly calls or the fortnightly Q&A sessions, there's always someone there to help you and give you some advice or guidance. So, you know, there's lots of support there. But Ilva, I just want to say thank you for this partnership, because it just shows that, you know, you really are looking after your patients and you really want the best for them.
Of course. That's the most important thing, and that's why we are here at all. And that whole team is also on the same stage of understanding, including the nurses even, and not even speaking about the doctors. And because this is a really, really important step in life. And so we are here to do everything to support and to help to go through this.
Because
thank you. Thank you. I think we will finish now. And if anyone has questions, please send me your questions, and we will do another session again. And it's so good.
Oh, take care, Ilva. Bye, everybody.
Bye bye.
Bye. Bye.